I know if I need decompression therapy? This is a great question for many patients. Decompression therapy is a therapy that's non-invasive and uh, low force for patients with disc pain. And if you have disc pain, um, you really want to be careful. You're already in a lot of pain, and you don't want to do anything to make it worse. So, how do you know if you have the need for decompression therapy? Well, there's a few things. Do you have numbness and tingling going down your hands? So you can have need decompression for cervical or lumbar spine. So if you're having unresolved numbness, tingling, and pain that goes down your hands, um, that's a good indicator that you might have some disc pressure. If your body goes into muscle spasms in your neck area that you can't control, or twitching that you can't control, and it just continues to go on month after month. So a way to determine if you need decompression therapy is to get an actual MRI and an X-ray, or both, and determine if your disc is bulging, or if it's extruded, or if it has a protrusion. Those are different levels of disc problems that surface and are shown only with an MRI, and that lets us see, is this a good therapy for this patient? Decompression therapy is good for patients that have numbness and tingling in their feet as well. Sometimes they even have um, neuropathy symptoms, and if it's true neuropathy, there's many different forms of treatment for it. But if your neuropathy pain is really from your back, then the decompression therapy can help that. So a way to determine that is for us to examine you and have a look at your MRI and determine if you need, or if decompression therapy is an option for you. And we take x-rays. We have our patients do an examination where we do reflexes and range of motion studies. And then we also do a flexion extension study on the neck or low back area where we're concerned, to see if the patient's bones are moving properly. If you move too much, you aren't going to respond well to the decompression therapy. So there's different criteria to determine, is decompression therapy for you. Many patients that need decompression therapy have been in car accidents, or they've had slips or falls, and they've had years of unresolved pain, and they just can never really get comfortable on a permanent level. And they need a series of sessions of decompression, and then they need to follow those sessions of therapy with rehab. They need to make sure that they create muscle tone in the spine so that they can hold on to those corrections that they may get through decompression therapy. So if you have any more questions about whether or not you need decompression therapy, my number is 805-474-4747. I'm Dr. Amy.